I am the chair of the Behind the Walls work group, and I am one of the executive committee members for MAJR and have been for the last 2 years. The first thing I'd like to do is just have the executive committee members introduce yourselves. If you could just say hi to all of the guests who are with us today.
Hi, this is Jim Rose on the executive committee, and I'm from Columbia, Maryland.
Hi, this is Crystal Francis. I'm on the executive committee from Baltimore County. Thank you.
Hi, I'm Bill Carlson. I'm on the executive committee. I'm from Millersville, and I'm the coordinator of the Front Door Work Group.
And this is Jenny Zito, who also does front door issues.
This is Phil Karoum on MAJR's executive committee from Annapolis, Maryland.
Pat Marks.
Hi. Go ahead, Pat.
I'm Pat Marks from Montgomery County on the executive committee.
Hi, this is Vince Greco from Harford County. I'm on the executive committee.
Hi, good evening.
This is Christopher Providence, who's our newest, we hope, executive committee member that we're going to introduce and officially nominate this evening. And we're very thrilled to have Christopher from Harford County.
Thank you, Phil.
And so if, are there any other executive committee members who have not introduced themselves? Has everybody introduced themselves? So now you know who we are. As Phil indicated, we are this evening nominating Chris Providence to become a member of the executive committee. Chris Providence is a recently retired. It's nice to be retired, isn't it, Chris? He's recently retired from a career of more than 30 years with the Baltimore County Public School System as a speech language pathologist. Beyond this career and experience with young Marylanders, Chris has experience as a spokesperson, an organizer, a thoughtful leader of an organization called Together We Will, Harford County, Upper Chesapeake. For those of you who attended the last MAJR front door work group, you will remember that Chris did a stellar job in finding a great guest speaker on issues of cash bail and home detention, and his discussion of the consequences of young people of early involvement with a broken criminal justice system was just outstanding. And so we nominate Chris to become a member of the executive committee, and Phil, you will give me direction on what the next step in the nomination process is.
The next step is to
take a vote.
Which could be done by folks giving a thumbs up personally or digitally. And we strongly encourage support. And I see many thumbs up are occurring in our Zoom session.
And I only see thumbs up and hands raised.
And there are a lot of thumbs up. So
I'm sorry, Phil, since I can't figure out how to do a thumbs up, but my thumb is two thumbs up.
Yeah,
in reactions, go to reactions.
I'm sorry, okay.
So thank you. And I see with Mary Stone, I see the gentleman with his actual thumb up. Thank you so much. And so unanimously, Chris You are now an official member of the Executive Committee.
My goodness, what an honor. Thank you, Olinda, so much for the kind words. Thank you. And thank you to everyone for your vote of confidence.
You're very welcome, and we are excited to have you on board.
Absolutely.
An honor. Thank you so much. It's an honor.
Joining up.
So the next thing that I would like to do, the next event on the agenda, is I just want to spend a few minutes, less than 5 minutes, just recognizing the importance of today. It was today, 50 years ago, September the 13th, that events occurred at the Attica prison in upstate New York, frequently referred to as the Attica Uprising. Anybody who has done work in prisoners' rights work, you know that this was a day that really changed the way that America looked at conditions in prison. It was an awakening. Before that, I would say that we had closed our eyes to what was happening behind bars, and this event made us notice and be aware of what was happening behind bars. But this event didn't happen in a vacuum. 3 days before the Attica Uprising, George Jackson, who was a former Black Panther, was assassinated by a prison guard in San Quentin. His death is actually what sparked the outrage, and that outrage turned into action. Additionally, 3 months earlier, the prisoners had sent a letter to the Commissioner of Corrections outlining conditions and asking for prison reform. On September the 9th, prisoners took control of the facility. They wrote a manifesto to the world that consisted of 28 demands for improved conditions. After a 5-day standoff, tear gas was dropped by helicopter and 2,000 rounds were fired by state police and correctional officers. 29 individuals who were in custody and 10 hostages were killed, and many more were wounded by this sea of bullets. The individuals who were in custody wanted to draw attention to things like overcrowding, inadequate medical care, discrimination and racist treatment, and poor nutrition. They wanted to be treated as human beings. This is still the message that we hear from men and women behind bars today. They want to be treated as human beings. My question is, if there was a manifesto that came from the Maryland institutions, what would that manifesto look like today? It would probably include information about treatment during COVID. It would probably include information about the continued lockdown during COVID. If you don't know, nationwide, 400,000 individuals behind bars tested positive for COVID in the last 18 months. When you include staff, the number is as high as 600,000. 3,000 people behind bars nationwide died from COVID, and 31 individuals in the state of Maryland. Most folks don't know that the institutions have been on a 23-hour or more lockdown for the last 15 months. If you are active in justice reform or the abolition movement, Attica reverberates through everything that we do. So I just wanted to take a minute today to remember those whose lives were taken in Attica in 1971, but also remember those who have passed away from COVID more recently, and also remember those who still suffer today. Thank you. So the next item on the agenda is to introduce a special guest. We have two special guests with us today, probably a few, but our first special guest is someone who is very dear to all of us. Dr. Crystal Francis has served on the executive committee for MAJR for the last several years. We are so excited that she is expanding her wings and making an impact in other venues. If you had an opportunity to attend the reentry roundtable that MAJR put on a couple of years ago, you will know that Dr. Francis is an excellent organizer. But we are very excited that she has recently been selected to be the Assistant Director of Program Management for Georgetown University's Pivot Program. This Pivot Program is a one-year transition and reentry program that centers on a blend of academic work and supported employment for formerly incarcerated individuals. I am personally familiar with the work that Pivot has done with men at the DC jail, and I know they are expanding to Maryland facilities, and we are just very excited that Crystal is a part of MAJR, and even more excited that she will begin this new venture where she can again make an even greater impact. So for the next 5 minutes, you will hear from Crystal Francis.
Thank you so much, Olinda, for that warm welcome. I am so excited to be able to join the ranks at Georgetown University to help lead their initiative to ensure that reentry is accessible to individuals in DC. Just to give you a brief overview of, what Georgetown Pivot Program does, and Jim just put a link in the chat for you to just learn more about what they do. As Olinda said, it's a reentry program. And many of you may be surprised because it's not customary for a university to take on such a task. And I was so thrilled to apply for the position, and I had an opportunity to sit down with the co-executive director to really learn more about how the program came about. But, the executive director, her name is Pietra, her brother served time in a prison. And so it was near and dear to her heart to figure out a way how she could make this impact, not being involved in criminal justice. And so she brought this idea to Georgetown. And Georgetown partners with employers to ensure that the participants receive an internship, they receive stipends to be able to provide the necessary resources and care for themselves when they're matriculating through this one-year program. They are educated in business and entrepreneurship, because oftentimes we know of the significant challenges that individuals face finding employment with a criminal record. Most of the time, individuals figure out a way to monetize a skill set that they have to make ends meet, because finding employment is very hard. And so as I was, doing research, my dissertation study was on reentry and employment when I graduated with my PhD in 2018. And I will tell you, the statistics haven't improved much, but I will say with this justice reform movement, there are lots of individuals, employers, and organizations that are starting to understand the importance of why formerly incarcerated individuals need to have access to employment. And I was looking at the prison policy organization. They do a lot of research, and their research shows that the unemployment rate for a returning citizen is 27% higher, 27% higher than the total US unemployment rate during any historical period, including the Great Depression. So that speaks volumes. And add COVID-19 to the mix. We know that employers are now hiring. We know that there is a lot of opportunity, primarily with some of the big employers that have identified themselves as second chance hires like Amazon and Walmart. But what was so impressive about Georgetown's programs is the quality of employers that they have at the table. I had an opportunity to serve as a life coach for one of the Georgetown Pivot program participants who had a chance to pitch for funding for her business idea. She won the pitch. And after she concluded her internship with Dick's Sporting Goods, because this individual was a former professional tennis player, she landed a full-time job making a great salary with benefits to join that company's marketing, diversity, and inclusion team. And so I will tell you there are many great stories. Another individual got a full-time offer from Deloitte, which is a very prestigious consulting firm. So I'm telling you, Georgetown is doing amazing things. It's so inspiring to see what kinds of employers they're able to bring to the table. And it lets me know that employers are willing to help. They just need someone to guide them on how to help and how to create opportunities for employment for individuals that have criminal records. So I will conclude with that. If you want to learn more, please check out that link. You're welcome to connect with me, and I'll have more updates about what we're doing. I also head up Backdoor, which is the reentry work group here, to talk more about what we're doing to try to make a better impact in the employment realm. So thank you for your time.
Thank you so much, Crystal. Thank you for sharing that information, those statistics. And again, we are so proud of you. And I know you will keep us updated with all the work that you will do through the Pivot program. We will now have reports from the chairs of our 3 work groups. MAJR has 3 work groups: front door, back door, and behind the walls.
My name is Bill Carlson. As I said before, I'm the coordinator for the front door work group, and the front door work group is responsible for basically all justice issues from when a person first starts their encounter with the justice system through their potential trial and potential sentencing. And at the last general meeting, I reported on some really great news from last year, in which we had 10 bills passed that were our priorities, which was really an all-time high for MAJR, including 4 major police reform bills and several others that were very important to us. But this time, I want to focus on what we've done since the last meeting and going forward. So on July 21st, the front door group had a work group meeting on Zoom, and we had 13 supporters present, very lively discussions. And as was mentioned earlier, our new executive committee member, Chris Providence, arranged a wonderful guest speaker named Matt Zenhalt. And Chris gave an excellent introduction to Matt. And then Matt, who is an attorney with the Baltimore Legal Action Team, shared his learnings from really a long time of helping clients in that organization. He was mainly here to talk about bail reform. And this was a little shocking to some of us because we had been supportive of some changes the judiciary had made to the bail system in 2016. But Matt had some data that showed that things were not working as well as we might have expected, especially in the data he has from Baltimore City. Specifically, there were fewer people actually being released on recognizance than previously, and it did not do anything to address a number of the racial disparities that existed in the various populations who either got bail or did not. One important thing he mentioned were some of the challenges around electronic monitoring, which was being tied to pretrial release, especially if the cost of such had to be borne by the person who was doing that. So Matt had several suggestions, one of which was to change the rules to allow more meaningful probable cause and bail review hearings. Those he felt were often fairly perfunctory. And secondly, he had an idea that we could perhaps have a rule that said judges had to say why they were incarcerating people without bail, as opposed to many of there were like, 15 other options to deal with people before their trial. And why is it that all of those were no good for this person? So those sounded pretty good. So Matt gave this great presentation. We then discussed 4 target areas for the front door work group in the coming year. That included 2 efforts on police reform, one having to do with the trying to move both the investigation and prosecution of police misconduct to the state level to remove it from local influence, and to work to eliminate the ability of police to lie to suspects, juvenile suspects that they are questioning. It was sort of shocking to some of us that that was even allowed, but it's apparently a widespread practice. And some states are starting to reform that, and we'd like to include Maryland among those states. We hope to continue our efforts on the Juvenile Justice Reform Act. That the commission involved with that act was extended another year, and we want to continue working with that group. We want to do something about prosecutorial discretion, and mainly to improve the transparency of the way prosecutors decide whether to charge people or not, or whether to plea bargain or not, and to try to understand both the racial and economic correlation of those decisions. Finally, we want to spend some time working on bail reform. Again, based on Matt's comments, we want to dig into that issue more across the state. So in closing, we're going to have a breakout session in about 10 or 15 minutes from now, and there will be one for the front door group. If you're interested in these issues, I hope you'll join us. We also are going to have a meeting. Our next meeting of the front door work group will be on October 20th at 7 p.m. So there'll be an announcement of that going up. And thanks for listening. That's my report.
Thank you so much, Bill. Our next report will be from Crystal Francis, who leads our backdoor work group.
All right, I'm back again. Thank you so much. Well, we have lots of great things going on with Backdoor. First, I want to give you an update regarding one of our priorities that we originally in 2020, we thought we would introduce as a legislative priority, but found out that we had support of the Secretary of the Department of Corrections, Rob Green, and he said that he would take on this task of developing a statewide reentry council without us needing to pass legislation. And I will let you know that I had an opportunity. Thank you to Marlene Beckman. I know she had a conflict today, but she was able to help us determine where the status of that is. Currently, Assistant Secretary Scruggs has moved forward with the reentry council, the statewide reentry council. They did decide to implement almost all of our recommendations regarding the structure of the council. What remains unknown is how they are going to select who the members are that are going to have voting authority, and whether or not there's going to be opportunity for community partnership and individuals to join that may not necessarily have a seat as a member on the council. So according to my last correspondence, they are going to be sending out communication to community organizations through the listserv that they have to make folks aware that the Reentry Council will be developed and how to join that council. I did make sure that our name, MAJR's name, is added to the listserv. I will be one of the individuals, and they promised to keep me abreast of the various phases, and Donna Rojas is supposed to be the one sending out the correspondence. So I will keep you updated for when I see that go out. Secondly, I would like to talk a little bit about what we are going to expect to do legislatively this year for Backdoor. One of the things that came up in our work group meetings, which also ties into what I talked about earlier today regarding employment, is the collateral consequences of having a criminal record. Our work group wants to figure out a way to minimize the collateral consequences so that people who are returning home have access to housing and employment. And I will invite you to join the Backdoor Breakout to learn more specifically about the approach that we plan to take, and also to contribute your ideas. And finally, we were working on developing a statewide reentry services directory to ensure that we can provide individuals with access to organizations that are providing service to individuals who are coming out of corrections or maybe have a criminal record, maybe they didn't serve time in jail at all. We are in the process of vetting a document where we were able, through our intern that served with us last session, was able to collect information for 24 counties across the state of Maryland. And we're trying to figure out a user-friendly way to display this information. So if you are a returning citizen and you are not connected to the Backdoor work group, and you would like to have a voice on how we disseminate this data and display this information so that it's easily accessible, again, I invite you to join the Backdoor work group, and I'll provide more specific details there. But that's my highlight, and thank you so much.
Thank you. Thank you so much, Crystal, for that report. So I will give the report live. Is that right, Jim? Am I giving my report live? Should I just continue?
Well, I mean, I can try it again if you'd like.
Well, let's see.
There you go. Let's see. Where is it? Here it is. Share that screen, and on the bottom left it says I'm supposed to see a button, but I don't see a button.
Okay.
No.
Okay. All right. I will go ahead and give my report. That means that you guys have to listen to my voice in person a little longer. So again, I chair the Behind the Walls work group, and we have been very busy in the last several months. Usually I hear that the summertime is kind of a slow period for MAJR, but that's not been true with the Behind the Walls work group. We've been very busy. First, I want to report that our team, that is the correspondence team, this is the team of individuals that responds to letters that come from men and women behind bars. They have been very busy. We get letters from individuals who sometimes are seeking personal help, and we make referrals in those cases. But very often individuals are writing us to provide us with information, and we often use that information as a part of our advocacy. Of course, we do so anonymously. One of the first things that the Behind the Walls work group has done in the last few months is we work with a coalition of individuals, other advocates throughout the state, to find out from the department what the plan is for reopening the facilities. And so post-COVID. And so on August the 2nd, we participated in drafting a letter that went out to Governor Hogan and Secretary Green, asking what the plan and protocols are in place for visitation reopening, for transportation, individuals being transported to the different facilities, regarding medical treatment, regarding the ongoing lockdown. These are the things that we raised, issues that we raised in the letter. Of course, we got a response from Secretary Green dated August the 17th. And of course, his response said that they are following CDC protocol and that everything is working out just wonderfully. And we know that that's probably not the case, right? And so what we have done is we circulated the response that we got from Secretary Green to men and women behind bars, as well as to the advocacy community. And we asked for feedback. So certainly if we find out that there are issues that they say that they are addressing, that we find out that they're not actually addressing, we will do some follow-up. After our last Behind the Walls work group meeting, we had a team of individuals who agreed to work on drafting a letter to Secretary Green regarding treatment programs and release planning. Many of the individuals who worked on that letter I see on the call today, and we thank you so much for your work. We know that that letter is near being finalized, and we hope to get it out within the next few days. We also had the opportunity on July the 28th to submit comments regarding some proposed changes to the Maryland regulations, specifically the regulations that have to deal with juvenile lifers and considering certain juvenile lifer factors when making decisions about classification, programming, and even parole decisions on behalf of individuals who are juvenile lifers. So we submitted those comments on July the 28th, and we await to see what the final regulations will look like. We also had the opportunity, and I believe that Phil Karoum will hit on this in his comments. The Chief Judge, former Chief Judge Barbera, was leading the charge to make some changes to the rules that allow an individual to get back in court after serving some time in custody. The proposed changes to Rule 4-345 had to do with two groups of individuals. One, a person who has served 15 years in custody and was under 25 when they committed their offense, would be able to file a petition in court after serving 60% of their sentence. The second group is individuals who are 60 years or older and have served at least 15 years in prison. And those are some large numbers, having to serve 60% or at least 15 years. And so there were hearings that were conducted, individuals testified on behalf and against the proposed changes. Phil Karoum did submit comments on behalf of MAJR. Unfortunately, in the end, because Judge Barbera reached the retirement age and the court was unable to actually take a vote on it before her forced retirement, mandatory retirement, I won't say forced, then it looks like that matter is now tabled. The last thing I'd like to report, and we will in our breakout room talk about the Ombudsman bill, which is a bill that we tried to get through last year, and the model prison bill. We will also talk about that. But I want to announce that the next Behind the Walls work group meeting is on November the 9th. And we hope that if you're interested in these kinds of issues, that you will join us. And the next thing I would like to do is to introduce Julie Majors. because we did have a group of individuals after our last Behind the Walls work group meeting who agreed to work with the Maryland Prisoners' Rights Coalition and Julie MAJRs on issues that are coming up as it relates to bills that that organization plans to introduce. So just to tell you a little bit about Julie MAJRs before she comes to give her 5-minute presentation, I will say that Julie certainly is someone who, if you're in the state of Maryland and you are concerned or want to know about what's happening to men and women behind bars, Julie is certainly a person to know. Since 2016, she has been the leader of the Maryland Prisoners' Rights Coalition. She has over 10 years experience in advocacy for incarcerated individuals, and she works specifically with individuals who have mental illnesses and those who have substance abuse disorders. But again, I would say, at least with my connections with Julie, that she really is a person who has a wide range of knowledge about what's happening to our men and women, family members, loved ones behind bars. And so we welcome you, Julie, and thank you for being with us this evening.
Thank you so much, and thank you for those kind words. And thank you for having me. Today I'm going to talk about correctional health care. To get right to the point, it's anyone here who's worked with me or knows me knows that that's near and dear to my heart. And the MPRC has been working on issues of correctional health care for a really long time. Notably so, as you had mentioned before, that this issue is quite a monster. And it's been going on for many, many years. We also field complaints on a weekly, daily basis. And I have to say that is our top #1 issue that comes through our door, our mail, and through the families is a lack of correctional health care. This is everything from chronic illnesses not being addressed, surgeries that are not being given, literally reports and records of people that are sick with open wounds and injuries laying on their floor and not being addressed. The medication issue not being given, not given properly, wrong medications given, people being given other people's meds, dosages that are absolutely off the charts incorrect, infectious diseases that are not being addressed, notably so, people that were released during COVID with either staph infections or MRSA that brought those home to their families. These are deplorable conditions which just equal a blatant lack of care and disregard for these people. I want to mention that one of our big clients, we happen to have the ability to pull all of his records. And over a 5-year period, this person has MS, and we took those records and went to Johns Hopkins. The head of neurology and several other physicians reviewed everything in his file from start to finish and found such a complete lack of care that they basically contacted me back and said, you need to contact an attorney because this doesn't even meet a minimum standard of care. We located through this investigation consistent levels of fraud, records that were blatantly deleted, because when you order them over time, you were getting different records from the records department, which is absolutely ridiculous. Incorrect meds that he was given that he was forced to take, or he would have been sent to lock up. Anyone who's directly impacted knows that that does happen. Denial of disability aids for 5.5 years, and many, many more violations. And we were, I hate to say that we were blessed enough to be able to get these reports and to get them from an outside independent physician that was able to kind of show this. And this is one person. These are reports and evidence that we are collecting for multiple people. These kinds of incidents are happening every single day. And it's really it's a very egregious situation. During COVID, when Corizon requested an absolutely exorbitant amount of money for COVID care, advocates kind of jumped in on this to show the comptroller and the treasurer and BPW that not only was COVID care not happening, but that these providers were blatantly ignoring their contractual agreement. They weren't giving chronic care, yet they continued to request money. And they requested a $29 million contract increase, even though they were unable to fulfill that contract. The hearings in May of 2020 analyzed the issue of COVID care and were a market response to this issue that has been going on for much, much longer than COVID. I hate to say that it was a blessing of sorts because it brought something to light that is historical. These historic failures have been going on for so many years, I can't even count. Peter Francho, our comptroller, stated, I guess the concern here is that we're simply reimbursing this company for its own failures as far as implementing the contract that they signed to and agreed. And here we are paying extra money and attributing it to COVID-19. That is pretty profound coming from our comptroller, that we are able to highlight these massive amounts of failures and years of money basically being thrown away and wasted. In June 2020, Prison Policy Initiative did a survey of how correctional facilities have handled healthcare during the pandemic, and Maryland received an F. They came back later in September of 2021, and we've only moved up to a D for healthcare response during this pandemic. I think that's pretty bad. So why do we need oversight? First of all, this is absolutely horrific. It's a horrific way to treat human beings, and it's a violation of rights, making it a huge liability. Second, it's an absolute waste of tax-paying dollars and drastically affects reentry outcomes. When we talk about collateral consequences, this is one of them. The way that we are treating people behind the wall is exactly going to affect them when they come out. It's huge. And it also makes it a public health issue. If we are debilitating people with their health while they're incarcerated, they can't be expected to be productive when they re-enter society. We conducted interrogatories with the department a couple of years ago, and that, coupled with our most recent response from the department, shows that the majority of any oversight that they do have is completely internal. I think we can all guess what policing yourself accomplishes, which is pretty much nothing. Literally complaints, and we have actually done this where we've contacted the Office of Inmate Health or another one of these offices that they list as an overseeing entity, and they basically state that their process is that the grievances go to the healthcare provider and they concur with them. That is not oversight. That is not independent, and it certainly doesn't meet a standard of care. Several of the entities which they do list, again, as being an oversight committee, don't actually oversee healthcare issues. They also do not receive and address any actual prisoner healthcare complaints. As well, the entities and offices are not comprised of healthcare experts, not social workers, no directly impacted voices, or anyone that could actually come close to judging or grading what is and what should be a health standard of care. From all of our research and evidence, the best way to just begin to correct these issues is to have an independent oversight board to address this mountain of failures and problems associated with correctional health care, from medical to mental to dental. Current practices are costing exorbitant amounts of money to the state, to our communities, and it's costing lives. We are introducing a bill that will establish a proper independent oversight board that includes those healthcare experts, includes independent voices, and we're asking for your support. The other, I'm going to push this over to Allie Preston, who is also with the MPRC, to speak about the medical and geriatric parole bill. Allie?
Hi, everyone. So as Julie said, we're also working on creating a new system for medical and geriatric parole in the state. What we have now is a really fragmented system. The code for geriatric parole and medical parole don't even appear in the same places in the Maryland Code. One is in the criminal law code and one is in correctional services. So sort of the first step of this is making sure that we move the geriatric parole, which is currently in the criminal law code, to its appropriate location in correctional services. And then from there, we have just some minor tweaks that are really aimed at making sure that these are processes that people who are incarcerated have meaningful access to. So for geriatric parole specifically, it will be working to ensure that individuals who are 61 and over are being evaluated for their eligibility for this geriatric parole process. And it will be focusing on having a more dynamic risk assessment than what is actually available to incarcerated individuals now. We know that in 2020, there were about 6% of the population who were technically eligible for geriatric parole based on age, but there's no system currently in place that ensures that these individuals will be evaluated for the appropriateness of geriatric parole. And then for medical parole, the big factor here is making sure that when these decisions are being made, that they're actually being informed by the best medical evidence that we have. Currently, there's one factor that's listed in the statute that tends to sort of swallow up the parole board's assessment of whether or not somebody should be eligible for medical parole. And that's based on something called a Karnofsky score, which is essentially just sort of a functional analysis of what people are able to do. And it ranges from 0 to 100, with 0 to 40 being the lowest functional ability for individuals. And that's listed as unable to care for yourself. And it requires the equivalent of institutional or hospital care. And it means that your disease is progressing really rapidly. And for certain low scores, this could mean that you were even days or hours before dying, before you actually get access to this process. So rather than focusing on a Karnofsky score, which the parole board essentially says, if you're above a 40, which is the highest part of that low rank, you will not be assessed for medical parole. So even if you're unable to work, even if you're unable to live on your own and you still need support for a lot of your functional needs, as long as you can take care of 1 or 2 functional needs on your own, you will not be eligible for medical parole. So what our bill will do is to have the primary focus be on a medical assessment that is either done by the institutional healthcare provider, or 2, actually give the incarcerated person the opportunity to request that an outside physician provide a medical analysis and report of their health status. And then again, elevating that so that the medical report, rather than just this baseline functionality assessment, is at the heart of the medical parole system. The decisions, excuse me. So it's really just ensuring that these processes that are intended to be compassionate release programs are actually going to be made available to the individuals who they should be made available to.
Thank you so much, both Julie and Allie. And we certainly look forward to, looking at the drafts of the bill and having input, certainly based on the information, that we get from individuals who write us, so that we can make the bill as robust as possible. But thank you so much for your leadership on that.
Thank you. And we will send that over to you, the copy of the bill draft and all of the information that supports it.
Great. Thank you.
Thank you all.
So we will now hear reports from very brief reports from Phil Caroon and then Jenny Zito, who will talk with us about some more front door issues. And so Phil, you're up.
Now I'm unmuted. So let me mention that another area that MAJR is concerned about, which is not strictly a front door, back door, behind the wall issue, is elections. Mm-hmm. While we're a nonpartisan group, we don't get involved in elections or endorsing candidates. we try and do public education and support on issues. Two important issues that are coming up, we expect, in the 2022 elections. One of them may be a possible legalization of marijuana. We expect in this coming session between January and April, the Maryland General Assembly probably will pass a bill to legalize marijuana, but they'll make it a ballot question so that voters would have to decide. While a lot of people disapprove of marijuana use, and this includes some on our major executive committee, you, our supporters previously, have backed this initiative for three important reasons. One is that we know from the memory of the prohibition of alcohol, when that prohibition was repealed in 1933, the crime that was associated with bootlegging and mobs just dropped precipitously. Law enforcement costs dropped. It was possible to safely regulate the purity of products that contained alcohol, and there was a lot of tax revenue. All of those same things would apply to marijuana legalization. In different places now where marijuana laws are enforced, the current situation is that they're enforced in a discriminatory way. Between 3 and 10 times more African Americans and Latinos are arrested for simple marijuana possession than whites. And in other states where marijuana has been legalized, as a third reason, it has been demonstrated that with public education and regulations, it is possible to prevent young people's use of marijuana from rising significantly. So that would be one issue that we hope to talk about and support in the coming election as a good thing for our criminal justice system in Maryland. The second relates to elected prosecutors. Folks may recall that several months ago, just before COVID, the Justice Policy Institute did a study which showed that the number of African Americans incarcerated in Maryland prisons is greatly disproportionate to the number of whites in our population, more than double, and that Maryland, in fact, is the most disproportionate in prisoner of African Americans in the United States, even ahead of Mississippi. So an initiative that we think should be discussed with prosecutors at the time of election is what can they do to add to transparency and let folks know what their policies are on plea agreements, on diversion, preventing people from getting into the system in the first place, and on the length of prison sentences. In other jurisdictions where progressive prosecutors have been elected, that includes Baltimore, but also includes Philadelphia, Chicago, Los Angeles. It can make a huge difference. So we'd like to work with the League of Women Voters to get questions on their voter guide about this. And we'd like to work with our supporters and other people around the state to make it an issue in state's attorneys' debates. We have, in fact, got a poll question. If anyone is interested in participating in a group to discuss this, you can check the box that is there in front of you to say if you would like to join in a workshop. This would be a one-time deal to discuss public education as to the elections. And secondly, if you are not currently on an email list with the work groups of MAJR, we would invite you to check the box and tell us there. So if you check
Bill,
that.
I have a question about this poll. I don't quite understand. The first question, it says choice 1, choice 2.
I am sorry. So it should say choice 1 should have said yes.
Okay.
So choice 2 would be no. So if you want to
Okay.
participate in this group, please check choice 1. This poll somehow did not come out quite as nicely as we hoped.
Another thing, which is, I think is probably a minor point, but for number 2, it says if you are not currently on an email list for a major work group, please select one of the 3. But you have to select one of the 3 in order to submit your answers. So
Yeah.
even if you are a member,
Actually, you should be able to check more than one of the 3.
Right, but you have to check at least
multiple
one.
groups.
You have to check
So
at
thank
least.
you to everyone who is responding to that. Again, choice 1 in the first question is yes. Choice 2 in the second and is no. If you are not on a work group and would like to get more information from their work group leaders about possible meetings, most of which are by Zoom, feel free. So we'll leave that up for another half a minute, and then we're inviting, I think, Jenny Zito to talk about criminalization of poverty, another possible initiative.
Phil, will you have email addresses for everybody?
Yes, if you check this poll saying you want to participate, we will have your email address.
Yeah, just
Okay, last push. Click the button, please. Answer those 2 questions.
All right, we're about to take it down. Again, thank you everyone for signing up. We'll have it down in another 10 seconds.
All right, so I'd like to suggest for anyone who has already filled in the poll that you take a 10 second stretch. Stand up and stretch, because if you're still with us, you've been sitting for an hour. So please stretch your body just to get the blood flowing. Thank you.
Thank you, Jenny. We needed that.
All right. So I'd like to show you guys a picture. Can you guys see this?
they can.
Okay. So yeah, wave if you can. Okay, so this was put
Raise
together
it
by the
higher.
institution. And on the bottom is the what percentage your family was in terms of income, your parents, what were they making in terms of money? So everyone
Higher.
Can you would help if people mute themselves, because then I would come
They
on
can't
as
see
speaker.
your thing.
Raise it up.
They're saying hold it higher. Just put
Higher
hold.
there.
Yes,
All right,
there
got
you
that?
go. Yes.
Okay. And then if people would mute themselves, then I'll show up on the speaker view, which would help make it larger. Okay, so along the bottom is what percentage your family was for income. So way over here, your family's making a lot of money, and over here, your family's making 0 money. And then over here is your chance of being incarcerated. And you can see that your chance of being incarcerated is about 4 times larger if your family was making no money than if your family was a middle income family. So what are the things that contribute to this? Well, one of the obvious ones is that you didn't get a good education. You didn't get a good opportunity for careers. So I think MAJR made some real strong steps in a positive direction over the last few years, working with a coalition, because Maryland just passed a massive education reform package, which is particularly focused on children that are raised in concentrated poverty. So that's a really good thing to keep watching. But I think the action areas where we can take some further steps right now are the areas in which either the law is being applied with unequally, so that people who are poor are more likely to get in prison. So for example, if you are trying to find a bathroom or don't have a place to sleep and you get arrested for being out on the street, that's certainly a law that is being disproportionately applied. The other area in which we need to do some research are the areas in which someone who's already in the legal system doesn't have the same outcome because they are poor. So for example, if someone is has less access to a strong lawyer and legal defense, they're more likely to accept a plea bargain. In that case, they may end up being incarcerated, thinking that that was the simple solution. Maybe they didn't trust the system to come out with a good outcome, and that's the best solution they could come up with. But that means that they then have it on their record, and then the rest of their life, they're less likely to be able to be employed and have a positive outcome. So one of the areas we might look at is, how can we make sure that the public defender's office has enough support so that people can get good representation. So there's lots of things to look at. Crisis response, trying to get people to the social services they need so they don't go into the prison system. And how can we help those people that are starting to get into the prison system and should get out before they actually get a record? Thanks. Hope to see you at the front door working group.
Thank you, Jenny, so much for that report. The next thing that we are going to do is to break out into the 3 breakout rooms. We're going to spend just 15 minutes. We ask that you hang in there with us, just 15 minutes in each breakout room, so that you all can discuss relevant issues. The chairs of the work groups will be in these meetings. And after you all have your 15-minute meeting talking about issues and priorities, we will come back and share reports from each of the breakout rooms.
And we should say there should be a spot that's going to appear on your screen letting you choose a breakout room. It's going to say 1, 2, and 3. 1 is the front door, 2 is behind the walls, and 3 is the back door. So those